I've heard you speak about, we're going to go a lot more into detail about
Sure.
the jaw. And so I've never heard someone focus so much on the jaw before. And, I can't help thinking, how is it that my jaw could be causing my knee pain? How is it that my jaw could be causing whatever it is?
Yeah.
For you and your perspective, why is it that the jaw is so important, and why should we be looking at the jaw in the first place?
So, a couple of things. Around your brain and spinal cord, you have what's called you've got three layers of connective tissue. The outer layer is called the dura mater. And it literally means, it's where endurance comes from. Dura means tough, mater, mother, the tough mother of the body. In Chinese medicine, this piece of connective tissue is called the governing vessel. Their literature says it governs all systems of yin and yang in the body, all systems of balance in the body.
Yes,
okay.
yes.
So it houses and protects the brain and spinal cord, but it obviously has to anchor in particular places. So it attaches in the sacrum and coccyx at the bottom, and then up at the top, in the cervical spine, the top cervical vertebra. And importantly, it has many attachments in what's called the sphenoid bone, which is inside your skull. And the sphenoid bone connects onto the jaw. I can get to it via its soft tissue connections, right?
Yeah.
And when we have restriction, and that's what my work focuses on, is this dura mater, right? The governing vessel. Because if you get that right, then generally other things start to disappear, right?
Yeah.
There's a reason Hippocrates, the father of modern medicine, said in cases of disease, look first to the spine. They knew this like thousands of years ago. And if the brain will use the jaw to navigate you through a gravitational field. So generally the first place we experience stress or trauma or anything like that is up in these upper durals. So the dura will contract in an attempt to protect the brain and spinal cord. What it's trying to do, I always explain this to clients when they come in, is if you take, a centipede, if you're watching overseas, but in South Africa we call them songololos, right?
Yeah.
If you touch a songololo, it curls it becomes like a disc, right?
100%, yeah.
So what it's doing is it's flexing in a protective sort of mode.
Yeah.
Our nervous system has that same response. So when we feel stress, what happens is this dura actually lengthens, it contracts and lengthens, and it's trying to curl us into a ball, okay? And when that sort of curling us into a ball becomes dysfunctional, we develop pain patterns, okay? Pain symptoms, let's say.
Yes.
So we have a lot of neural attachment, dural attachment, I beg your pardon, neural tension in our jaws. And our trigeminal nerve, its C fibers, so its pain receptor fibers, are 100 times more sensitive than other pain fibers in the body, right?
Yeah.
And so your bite can be out by 3 or 4 mils, and everyone's is, trust me.
Yeah.
And it will irritate the trigeminal nerve, and then we get a dural contraction.
Okay.
And when the trigeminal nerve is irritated, the brain produces a neurotransmitter called substance P. It's so prevalent in response to pain. Okay, sorry. So animals produce it. Slugs produce substance P in response to pain. So it's prevalent within biological life.
Yes.
And the moment the body produces substance P, it's a modulator of cytokines, right? So cytokines are the inflammatory response in the body.
Yeah.
So when your jaw is irritated, you have systemic inflammation throughout the body. It's not necessarily just in the jaw. It often manifests as teeth grinding and headaches and migraines and those types of things. But when people come in with shoulder, elbow, wrist, I immediately go, well, it's got to be upper durals. But even if you start to look at how the meridians, and the really fascinating thing is, for centuries the Chinese medical sort of paradigm has said there are these meridians within the body, and they distribute chi or energy. And modern medicine will tell you these channels exist. They are just fascial channels, right? They are connective tissue channels, and if you overlap the meridians and what's called anatomy trains, there's like a 98% correlation. It's the same thing, they're just talking a different language.
Correct.
And so you have connections from your jaw via those fascial connections into the knees, believe it or not, into the pelvis. And so sometimes knee pain can be jaw pain as a result.